Pediatric cardiologist Dr. Mashawn Jonikin says back-to-school season is a great time to reset and form healthy goals. She says a physical exam before a student starts a new school year can address some hidden health problems.
Children often suffer from asthma. They can even suffer from high blood pressure or scoliosis. These are things that oftentimes may not be totally picked up on because they aren't necessarily symptomatic.
For younger children, some vaccinations are required before they start kindergarten. Those include DTaP, polio, measles, mumps and rubella or MMR, varicella. Lexington Fayette County Health Department District Nurse Jill Keys says vaccinations have an impact beyond just one person.
The more people that are vaccinated, the less likely there's an outbreak, the less likely more people will be affected.
Keys says she's seen some parents hesitant to give their child certain vaccines. This information from Johns Hopkins Bloomberg School of Public Health shows state-level immunization coverage in Kentucky for MMR vaccines is below national levels. The state's immunization registry dashboard for the last school year shows only 7% of Kentucky counties meet the 95% safest threshold, and 60% fall below the 90% threshold. It says the majority of the state's kindergartners are in communities vulnerable to vaccine-preventable disease outbreaks. Lauren Pinson has 2 boys and is also a nurse. She says having children fully vaccinated is very important. Her 7-year-old is entering into kindergarten.
I work with adults, not children, but I think it's pretty obvious from the measles outbreaks that we're having right now in the country that not getting vaccinated is becoming an issue, especially with preventable diseases like measles that are highly contagious.